Good afternoon. Thank you for joining us today. I am Kara Dina Sale with the Community Technical Assistance Center at the New York University Silver School of Social Work's McSilver Institute. And I would really like to welcome you to today's training called Applying an Intersectionality Lens to Mental Health Service Delivery. Intersectionality is a theory and practice framework that has actually been around for a very long time, but wasn't named until 1989 by Dr. Kimberly Crenshaw. Dr. Crenshaw coined the term intersectionality to describe how multiple forms of discrimination, power, and privilege intersect in Black women's lives in ways that are erased when sexism and racism are treated separately. Dr. Crenshaw and others have helped us to bring this to the forefront in both legal and human service areas. Intersectionality is fundamental towards providing effective mental health service delivery and care with youth and families. It includes using one's whole self in care and relationship, and also alleviates future harms. This is all critical for caring for those who are historically marginalized and continue to be impacted by various intersecting systems of oppression, which is why we are having this webinar today. Today, our presenters will explore the intricacies of intersectionality through a sociocultural, ecological, and social justice lens, and you will learn practical insights and strategies towards applying intersectionality at an organizational level and among individual clients. We're going to begin today's webinar with an overview around intersectionality and what it means, and what historically what it has looked like, and why we are having this webinar. And then we're going to move into a facilitated discussion with myself and our amazing presenters, and then we'll end with a Q&A. So I will be collecting your questions through the chat along the way, but please also save your questions for the end if you have any or if they come up. Our presenters are KK naimool and Laura Brown Rivera. KK naimool is founder and principal partner of Collective Justice Consulting, LLC, as well as founder and executive steward of Queer Family Network, a fiscally sponsored initiative to support LGBTQ plus families in the Mid-Hudson Valley of New York State. KK is a nationally recognized and sought after equity consultant, passionate about equity and accessibility. KK develops tools and training for groups and organizations looking to apply best practices in diversity and inclusion, cultural humility, and systemic justice. KK has trained thousands of health and human service professionals on LGBTQ plus health equity and assisted organizations and programs to review processes to prioritize impact over intention. In a multi-year project, along with a team of LGBTQ plus researchers, activists, and scholars, KK helped develop an LGBTQ cultural competency training toolkit, the first ever nationally recognized standards of LGBTQ plus cultural competency training. Additionally, KK was recently appointed as a member of the Mid-Hudson Anti-Bias and Hate Prevention Council, one of only 10 regional councils launched by Governor Hochul. And we're really grateful to have Laura Brown Rivera, social worker. Laura is an activist, educator, and licensed therapist with a fierce love of community and a commitment to social equity. Laura brings an intersectional identity and a radical womanist restorative justice lens to her therapeutic practice. They are passionate about working with young kids, teens, and young adults, people of color, particularly those navigating predominantly white institutions, and folks who are struggling with identity and self-esteem. Laura has significant education and experience in the field of child development with a clinical focus on cultural identity development, self-efficacy, and those significantly impacted by adverse childhood experiences. Laura has over a decade of experience with psychotherapy, mentoring clinical supervision of graduate students, education and training, and IO and DID consulting in a variety of settings, including primary, secondary schools, hospital inpatient, nonprofits, grassroots organizations, mobile crisis teams, in addition to their private practice, Live Your Truth, LYT counseling. I just want to remind everyone that you're on mute to avoid any background noises. If you have any technical issues today, please chat to me and we will be able to assist you. And then, of course, please use our chats liberally. Without further ado, I am going to pass it on to our incredible presenters and people, KK Naimool and Laura Brown Rivera.
Hi all. So I'm KK. If you couldn't tell from the Bitmoji, my hair has grown somewhat. But I am so excited and nervous and pleased to be here today, because when I talk about intersectionality, it's not just a concept, it is how I navigate spaces as a human being. And so today's agenda is sort of a brief introduction, because we only have 2 hours, to theoretical frameworks and tools to help you understand and use the intersectionality framework in your day-to-day work, because you're probably doing it already. And also to understand how valuable it is as a tool and how it improves your ability to give care. And when I say practice or do what you're doing, the word I sort of try to live is praxis, which is a conscious thought about why and how I do things, knowing potentially how that may impact others. So praxis is a little bit deeper than just doing something mindlessly. It is a thoughtful way of understanding why and how we do things. And so we're going to talk about praxis in terms of using this intersectionality framework and the other frameworks that I apply in my work. And then what we're going to do next is, because we want you to leave today with some understanding of how to move your practice into praxis, is to learn who you are in this moment and how you can leverage your own identities in your therapeutic relationship to build trust and relationships with your clients and your colleagues and your coworkers. Next slide. And so I encourage you in this conversation we're going to have today to ask questions. Ask any question. If you're terrified of asking a stupid question, send me a private message and I will share the question without your name. Do it to anyone here that you feel a connection with, because we are all learning together. Intersectionality has existed throughout time, but the language to talk about what we're doing is fairly recent. And so we're learning together, because what works for me will not work for you. And listen with curiosity. When we're talking about people and their multiple intersecting identities, none of us are experts. And so be curious in that you're listening to learn and not to judge. And what someone does or says about a certain topic is not about you as a person. And that's how we practice self-care in this conversation. And also challenge ideas and not people. If I say something that makes you uncomfortable, let's sit with that discomfort and challenge what I'm saying, not me as a person. I don't need for you to tell me that you disrespect me at the end, right? So we're going to start with just a quick definition on what is intersectionality. So the next slide is a Merriam-Webster dictionary definition, so that we can have a solid foundation as we just use the word intersectionality throughout our presentation. And so it is a complex and cumulative ways in which multiple forms of discrimination combine, overlap, and intersect, especially in the experiences of marginalized groups. And so also know at the end of this presentation, you will have a comprehensive tool where we share our resources as well as a resource list, so that you can follow up and read these so you don't have to memorize anything. But when it comes to this definition, we need to understand that it's not just a snapshot of someone's life. It's sort of seeing them holistically as a whole person and trying to understand who they are in the moment, in the context of where they are. And so underneath that definition is a quote from a professor of sociology who applies the theory of intersectionality in her work and sort of tries to understand how this works in her research. And so you have now 2 resources, because you will also have the slides, sort of help build your foundation as you navigate spaces talking about intersectionality. So next slide. And so we talk about intersectionality and seeing a person as they exist in this world because we do not live in a perfect and equitable world. We actually live in a society that has a history of inequity. And for many of us, based on the identities of our foreparents, our ancestors, the ways in which history has navigated us getting to this country, to this soil, is fraught with systems of oppression. And we can't talk about intersectionality without talking about people's experiences in the country we live in the state we live in the fields that we've chosen to build our professions in. And so this image is a quick sort of like, these are the main systems of oppression. There are many more. We are not going to be able to capture it on one slide. And again, you can interrogate and ask questions about these when we get to the panel discussion or the Q&A. Next slide. Because as we navigate these spaces and we exist within these systems of oppression, intersectionality is a framework to help us understand who we are in the context of these spaces. And so at any given moment, the identities that I have that are most salient are usually the ones where I feel most terrified about in that moment. So when I go to the airport, I am super conscious that I am brown, that I have a Muslim last name, that I have TSA pre-check, and almost without fail, I get pulled over for a random screening and I have to take my shoes off and take my belt off. I've gotten to the point where I just wear pajamas to the airport and I still once had to take my flip-flops off because intersectionality means that the conversations around safety happening at the airport usually use me as the example of what's terrifying. And so people doing their jobs have been primed to see me in a certain way. And I understand that. And in that moment, in the context of the airport, I am very conscious of my identities as a brown person with a Muslim last name, who is also an immigrant to this country. And I will say that I am also queer. And in those moments when my hair is cut short and I look really queer, I feel safe in my queer identity because I can't be insert what a terrorist looks like here. And we have to talk about this because we're humans. Next slide. And so when Kimberly Crenshaw was talking about the intersecting identities of being Black and being a woman, she wasn't just pulling this out of thin air. She was very conscious as a person who's lived this reality that when we talk about marginalized communities, the more intersecting identities we have who experience greater prejudice or experiences of discrimination, we tend to be the folks who need the most care. And so these statistics are from a national database of violence against women, violence against Black women. And we need to talk about these disparities because as caregivers, these are the bulk of our clients. Black and brown women and other gender minorities who've experienced violence because of those identities or perceptions of their identities. And so these national statistics are something that we see on a daily basis. And we know that for communities of color, because of an experience of stress, discrimination, and prejudice throughout our lives, we're hypervigilant. We have experienced such stress and trauma. And as therapists, as caregivers, as mental health providers, you see this show up in behaviors and coping mechanisms that may not be the best for us. And so this is not about being woke, although secretly it is, and we'll talk about that later. It is talking about being aware and conscious of the world we exist in and that not all of us have equal access. Next slide. And when we talk about those systems of oppression, we're not talking about right now in this world we exist in. We're talking about histories of oppression that have interrupted and kept people from having access. So in this slide here, we see on the upper left, a sepia tone photo of Henrietta Lacks. If you don't know who Henrietta Lacks is, she basically, without her knowledge, has made significant contributions to the world of medicine, cancer research, cosmetology, sports medicine, without earning a penny. Henrietta Lacks went to a hospital to figure out what was happening with her body. And the doctor, who I will not name because I'm going to name some other doctors, took her cells, realized that what was amazing with Henrietta's cells were that they were resilient. and they can withstand testing and experimenting more than any other cells they had ever used in their experiments. And so he took them. He reproduced them, and he did research, made billions for his hospital, and then he sold his research and his cells to so many industries across the nation and the world. HeLa cells were used to build billions and billions and billions of dollars of wealth that never made it to Henrietta's pockets. And we need to talk about that because that is the history of Black women in this country. Below Henrietta's image is an image of Dr. J. Marion Sims, who is named and labeled the father of gynecology. But what we need to understand in the context of his practice was that he experimented on Black enslaved women's bodies without anesthesia. And when he documented his research, it was clear he didn't know one person from another because he used their names interchangeably. And he also built his devices, which I will say are very uncomfortable for people who need to go to a gynecologist, because they were not done with care and about the safety and the comfort of the patient. And we need to talk about this because when we talk about systems of oppression, I've so far named medical research, the cosmetology industry, I've named gynecology and the father of modern gynecology. And so when we look to the right, we can see what people do when given a historical context where we see some people as not quite human, what happens. And so the top right has the article printed and published in a peer-reviewed magazine in 2011, where a bunch of male doctors thought it would be valuable scientific research to rank women based on their attractiveness because of a diagnosis of endometriosis. So we're talking about something that impacts a lot of people with uteruses and cause significant pain that is very debilitating. And rather than trying to understand how to soothe that pain, take care of this thing that many, many, many people with a uterus have to endure, they wrote an article on who's pretty. And it was published in a peer-reviewed article and was only pulled when women researchers, female researchers, and I say women knowing that I'm not saying trans women, because we also know who gets to be researchers on subjects of women, or trans men. And so when we talk about the historical context, this slide is just a tiny tippy top of the iceberg of the ways in which people with marginalized identities have been rejected and denied access to talk about their own experiences. And on the bottom right, we have images of the last remaining survivors of the Tuskegee experiment, where Black men with syphilis went to seek care. And instead of seeking care, they were given placebos because the researchers wanted to see what happens if the disease was left unchecked. And I'm just going to leave that there without explaining why that is terribly wrong. Next slide. And we just talked about what it looks like in science, but when we talk about people's experiences and their just very existence, we know that another identity that experiences discrimination, and you can see it in the news right now, are members of the LGBTQ plus community. And we know that LGBTQ plus people have always existed. We know that Black scientists and doctors and inventors have always existed. We know that women scientists, inventors, and doctors, caregivers, midwives have always existed. But because of who gets to write history, those histories have been erased, rewritten, and denied. And we need to do our own work to try to understand the experiences of these communities, because those are the communities walking into our offices for care. Next slide. And so We can say that we've made a lot of progress, but I will say that the civil rights movement was only in the late 50s and early 60s. And many of these big wins that we see here have had zero to no impact on the communities who advocated for these rights, because we exist in a society within those systems of oppression. So when we talk about the ADA, the Accessibility Act being in existence since the early 70s, I will let you know that the number of people with disabilities in the workforce has not shifted. So we can see how policy makes things look, but they don't actually create impactful change within the communities, because many of them were not consulted in addressing the systemic issues that we face. And today we're having a conversation where people are already saying that DEI initiatives are dead. The same DEI initiatives that were only started, and I put this in air quotes, in 2021. And so when we talk about how far we've come, I want you to know that that does not translate into interpersonal behavior or significantly change the experiences of people of those identities, because we haven't dismantled those systems. And intersectionality as a framework helps us understand that. Next slide. And so intersectionality is a theory of oppression. It is now used as just a buzzword. People just drop it into their resumes, into conversations, but it is a theoretical framework that helps us understand oppression and understand people's experiences. And so we're going to talk for the rest of our session about how we apply this theory, this framework, in our individual practice, and how we take it from practice to praxis. And I invite you to tell us what you do, because we are all learning together. So next slide. And so we know that we live in an equitable space. And we know that what walks through our doors when people seek care are just the tip of the iceberg. It's what folks have internalized, and it's how we interact with each other. But what we're not addressing, or maybe not seeing or having the conversations about, are the institutional and ideological ways in which these behaviors are reinforced, how these oppressive and prejudiced thoughts foment the way we navigate spaces. And so we need to understand that the theory of oppression is, as intersectionality is a theory of oppression, we need to also understand what is oppression. And so we look, there's different ways in which people are oppressed. Next slide. And so using these 4 levels as an example, we're going to talk about racism, because it's something we've talked about a lot for decades. We've talked about the ways in which structurally Black and brown people have been denied access to opportunity. We've talked about the ways in which Black and brown people, members of the Asian community, because again, Asia is a very large space that holds a multitude of identities, have experienced violence navigating normal communal spaces in this country. And we know that these are reinforced systemically through the ways in which we are required to list our spouse or our husband or our wife when we seek medical care, when the question that the form should be really asking is, who do I call when something happens or you need to get a scary diagnosis? We need to understand that the things that we take as normal, many of them are cemented in those systems of oppression because they've become our society and our cultural context. And many of us internalize those thoughts and those experiences as some sort of validating value system of who we are in society. So if you're fat, disabled, you speak with a lisp, or you have an accent, you begin to think of yourself as not good enough. And those are the folks who show up in our offices. Next slide. And all oppression is connected. Imposter syndrome is not real. We call it imposter syndrome because we victim blame. We have people questioning their entire right to be there, when in reality, society pushes folks out. And so next slide. So when I try to talk about the work that I do and the praxis I use, I'm going to share with you the tools I use to hold myself accountable and the tools I use to be able to talk about why I do the work the way I do it. And so the first thing I use, next slide, in my praxis is trying to understand what it means to be accountable. Accountability means a repairing of a relationship. It's restorative justice. It's not just saying I'm sorry and then continuing to engage in the same behavior. It's saying, I'm sorry, I don't know why I did this, but I am going to learn. And it's taking responsibility of trying to do better. And so this amazing image is from a person on Instagram who creates the most brilliant tools to learn about accountability. You will get this in your resource list. But every time I use their slide, I write them and I get their Venmo and I send them $100 because I pay people for their work. And so next slide. I'm trying to understand what accountability looks like in my practice. And I also want to understand what it is that is causing it to be so difficult. And so a tool that I use that I have found that has been very impactful in understanding and navigating spaces is Dr. Kuhn's 13 characteristics of white supremacy culture. It names things that I've experienced as a person of color, as a person people perceive as a woman, because I'm also non-binary, and how I get treated. I am an immigrant. I'm from the Caribbean, and people look at me and they assume I'm South Asian, and my IQ points just like skyrocket in interactions. And then they find out I'm from the Caribbean, and I see it slowly start reducing in the ways in which people interact with me. And I needed to understand that because our experiences are real. And if you are a woman or someone perceived as a woman of a certain age, you start to see that ageism trickling in. That doesn't work the same with your colleagues who are passing trans men or cis men of the same age and same experience. And we need to talk about it. So as a tool, these 13 characteristics of white supremacy help me understand patriarchy, sexism, misogyny, and the ways in which being nice and quiet are ways to police racial minorities and gender minorities in spaces that were built predominantly for cis white Anglo-Saxon Christian men. And we have to name these things. Feel free to ask me questions or rebut this later on. Next slide. And another tool that I use are the design justice principles. I'm a member of the Design Justice Network. These are 10 ways in which I try to pursue my research. I've worked with many researchers all over the country on trying to understand community voices. When I do this in my own consulting practice, I try to keep these at the forefront of my mind. And you all are very much away with the concepts here because it is no different from patient-centered care, which is another framework that takes this information and translates it into a way of having a patient tell you what they need and trust you to say why they need it or how it is they came to be in front of you. And so this is just one tool. I know NASW has their own guidelines of practice. I know PATH has their own guidelines of practice. The APA has their own guidelines of practice, and they're all very similar. Basically, what they say is to ask impacted folks what it is they need and how best you can help them go through this process of care with you. And so I use the design justice principles. I'm a member of their network, and I hold myself accountable by really checking myself to see if I follow through or where I'm failing. And I promise you, I fail quite often because I exist within a system that makes it difficult for me to do this on a daily basis because it's exhausting. It is exhausting to check my slides to see if they're accessible. It's exhausting to find someone to translate something in a different language. It is exhausting to get someone to sign, when I'm speaking in public. And I have to acknowledge that I'm imperfect at doing this, but these are my frameworks and the ways in which I try to be better. None of us are perfect. And to, flash back to Dr. Akun's 13 characteristics of white supremacy, one of them is perfection. Many of us don't do what we need to do because we know we're not going to be good at it. But not doing something causes more harm. And so I encourage you to go out there, make mistakes, but learn how to apologize and be accountable for our behaviors. Next slide. And I work in collective. I talk to people about how we can work together, and it is frustrating because I operate very quickly. I think very quickly. I'm about action, sometimes action before thinking properly about it. And this keeps me aware that I don't need to get a big win for something to be a success, and that small is good. And so these are Adrienne Marie Brown's emergent strategy, if you've read it. So they're the elements and the core principles put together in a way to help me understand that counting how many people we gave, who come in our doors is not necessarily a measure of success. It is a measure of grant funding. But how many of those people come back? Very rarely do we count folks who continue to follow their treatment protocol or reward them or celebrating anniversaries with them, because we're so busy with trying to make the grant numbers. And so this helps me recognize that small is good. And I will celebrate the young person who gets a job for the millionth time because small is good. And maybe they hold it longer than the 2 months that they did last time, or maybe they don't. But because we can have that conversation, I'm able to celebrate those small wins and keep myself in contact with the young people I work with. And so part of my bio, I used to work in foster care, and I left when many of those kids sort of graduated from foster care to prison. And I didn't want to be part of a system where the young children I was nurturing became young men who were victims of violence and then perpetuating violence. And I can see it happening. I could not sustain that in my heart. And funnily enough, because of the relationships I built with them, many of those young teens are now young men, some of them with their own families, who will reach out to me and say, hey, I just got, an associate's degree. I might be 30 something, but I just got an associate's degree. I got promoted at work. And to me, Emergent Strategy by Adrienne Marie Brown helps me celebrate those and see the impact of my work beyond the dollar value of a grant, beyond the number of people that come in for services. And so these are the frameworks I use in my day-to-day praxis. Next slide. And these are the values of my consulting practice. It took us, oddly enough, 9 months to create this baby of values. And it is built in all of those frameworks that I just shared that I use. And we strive really hard to see that everyone is valuable and has worth. We don't throw people away. And we sit with the discomfort when we find ourselves rejecting people or the things that they say when we're navigating hard conversations. And we apologize and we talk to each other. It is quite uncomfortable. Sometimes we have team meetings where we're like, I don't want to be here, and I would love us never to bring this subject up again. But we talk about it. And rest and healing, your self-care is radical. We should not feel selfish for saying that we need a moment to heal. And so these are the frameworks that I apply to be intersectional in my work. And as we continue the presentation, next slide, my colleague and friend Laura is actually going to talk exactly about what you just brought up. And I'm going to say, Lael, I hope I pronounced that right, what you just brought up in the chat, how we apply these sort of individual interpersonal ways that we navigate our own spaces from a macro perspective and how we take it to these large complex systems. And so, Laura, it's all yours.
All right. Hello, everyone. I just wanted to acknowledge and put out there, or first I want to acknowledge KK. Thank you so much. That was so much information in such a short period of time. So I really appreciate you. Um, and I want to acknowledge I'm a little nervous today because this opportunity and this topic means so much to me. And I guess that's where I want to start. I want to start with the political is personal and going through social work school and trying to develop my practice and my praxis. There was that very traditional model of psychotherapy, very Freudian, where you're separate from what you do. And I found that that wasn't authentic to me. And so I had to embrace who I am personally, flaws and all, in order to connect with folks and help them navigate systems. And I am kind of a social work butterfly in terms of the fact that I've worked in a ton of settings. So in my bio, I know Kara spoke about different systems, but I've worked within the foster care system, within the within family courts. I've had court mandated clients. I've worked with IDD population and OPWDD. I've worked with the Department of Health. So I've worked in patient settings. So my journey, at least, is to ponder these questions on how to apply the core values that KK espoused and their core values of mine, but how do you integrate that into your daily practice? So next slide. So in the slide, I basically went back to basics. So in terms of basics, talking about what I learned in social work school, when you're thinking of a case and the lifespan of that treatment session, we are taught that you first start with case conceptualization and all the knowledge and all the experience that you gather before you even meet that person, before that person even comes through the room. Then you have your assessment phase, then relationship building, treatment, and termination. Next slide, please. All right. In my experience, because I am truly a student and I truly love developmental theory, and that's where my passion lies. I often go back to Yuri Brofenbrenner, and Brofenbrenner created the ecological systems model, and really, again, these are theories that have been known within oppressed cultures and within marginalized people, but Brofenbrenner really broke the system into a model that was easy to understand and to apply. So basically, to say that the person is constantly interacting with their environment and their environment on different levels. So in the middle of this graph, you see the individual, right? And within the individual, what their health is going through, what their body is going through, just even maturation and growing, all of that affects who we are as a person. And then we have our microsystem, and our microsystem are systems in which we have direct interaction. So our families, our peers, our religious communities, our schools, and our workplaces. I've done many trainings on just workplace support. And in general, in our American system, we spend most of our time and most of our lives within the workplace, more than we do our family, more than we do other aspects. And that's how our culture is aligned. So to really think that those levels interact and the things that are going on in our workplace or in our schools or in our family are going to affect our mental status within us, right? Then we have the exosystem, and the exosystem talks about different public works media. So it's things that we're interacting with on a secondary or tertiary level. There's things that are all around us, even though we may not have direct access to it. So I may not know all the celebrities, but especially if you pull up Real Housewives, I can give you all the gossip. I can give you all the tea. And what that media, what local politics, our healthcare system, all those designed really affect not only my life, but affect who I am as an individual. When Nene is in pain, I am in pain. But basically, all of those things impact us as well. And then our macro system are the larger cultural influences. That's where we get our isms. So our culture, our laws, religion, dominant values of our culture really shape my day-to-day experience. And then the chrono system, the effect of time and history on development. And there's that age-old team building exercise that really falls apart really quickly in predominantly white organizations, where they're like, wow, if you could travel back to a moment in time, which one would you travel back to? And for most people of color, they're like, slim pickings. What do we mean? And so really the effect of the chrono system or our history really impact in terms of even generational trauma, generational healing, the way that my ancestors subverted and navigated through systems is within my body, and through somatic practice releasing that. But that is there. Next slide, please. All right, so to harken back to KK's wonderful images, but I love that image of intersectionality where all of the different circles are intertwining. And that visually to me reminded me of a kaleidoscope. And that's somewhat how I describe intersectionality. All of those experiences make up pieces of our experience. And when we're talking about a lens, especially a clinical lens, that shifts. The colors, the patterns that you see, the patterns that you recognize or emerge come from our prior experiences, come from our environment, and also come from our identities. So when we have all of these multiple identities, in terms of intersectionality, they're puzzle pieces that come to create our lens. But the thing with this kaleidoscope is that also that lens shifts. So in different scenarios, just like KK was talking about going to the airport, there are certain identities that become more salient to them. There are more certain patterns that they're identifying in order to keep themselves safe. And different situations, different environments, different people bring up different behaviors. And that's really the essence of therapy, is identifying not only our thoughts, but our behaviors. And it's really important in terms of intersectionality to realize the impact of all of these different environmental choices and all of these isms on our behaviors and ourselves. Next slide, please. All right, so all of that prior, all of those systems build up our case conceptualization, right? What we learn in school, the things that we focus on, our lenses, that really affects how we're going to treat that person who's walking through the door, or if we're walking through their doors, right? So I want to talk about, in terms of the next step, assessment, the tools in which we use to assess, especially the Diagnostic and Statistic Manual, as well as the ICD. All of those systems, a majority of those systems, they were built, and the science behind those, we have to acknowledge who is in the room making those decisions, right? When we talk about science, and especially as our field, when I say our field, as social work, leans more towards a medical model, leans more towards research. In terms of research and the medical model, who are the stakeholders? Who are the people at the table making those decisions? Even for myself, as someone who is extremely interested in developmental theory, most of the theories that are available to me from Piaget and Mahler, they're coming from people with European experiences, mostly men who are from European experiences, talking about individuals who are male and have European experiences. And then the Diagnostic and Statistic Manual is created to define those experiences for everyone. And this is a whole other training that I love to do, talking about the history of the DSM, especially in terms of marginalized populations such as women, where we have, you know, hysterical diagnosis of women being hysterical, the connection between the borderline diagnosis currently and people of color, women of color. That is definitely a connection. So there's a lot that, so what I'm saying is not necessarily to throw out your DSM, because these are tools that the systems that we're within, when we work in a clinic, when we work in a system, when we're billing insurance, the DSM, the ICD diagnoses are the shorthand that we use to communicate with each other. And they are tools within the system. So it's really important that we understand these tools, but it's also really important that we understand the limitations of those tools and the history of how those were created, and acknowledging the blind spots. Next slide, please. All right. So also within assessment, something that I love to bring up is our ACEs. And so ACEs, ACEs in general is a theory that was coming up, that talks about adverse childhood experiences, and that the traumas that we experience in childhood really can affect not only our current mental state, but can affect our future health outcomes. That people who have instances of abuse, neglect, and household dysfunction, that they have poorer health outcomes in later life. And so really that outlines the impact of our microsystem within our own health, talking about long-term and complex trauma. But where ACEs has sometimes failed, we have to also talk about, again, who was at the table creating ACEs. ACEs came from the medical model, came from childhood pediatricians and psychiatrists, creating these notes, things to note in terms of what could impact someone or a child, specifically their functioning. But within that, what is missing? What is the daily impact of being a brown person within a racist society? What are the outcomes or the impact of ACEs, of going through those adverse childhood experiences when it comes to identity? What is the impact of people who come out within a microsystem that's unsupportive, or a family structure that's that is not supportive? And how does that not only affect their current status, but also how does that rearrange their trauma response on a biological level? All right, next slide, please. All right, so, and then again, so when we think about treatment and being in school, even when talking to other caretaking professions, you can talk to any nurse, and when they say, hey, when do you create a treatment plan? You can create that treatment plan immediately. As soon as you see a patient, you start developing a discharge and a treatment plan and a discharge plan. And that's because our medical system is largely capitalistic. That's what we are taught to quickly process people in and out and meet SMART goals or measurable goals, right? And the issue with this is that sometimes with complex trauma, with many different intersections of identity, that the work can be messy, and sometimes it does not fit within the guidelines that are given to us. Sometimes the goals don't fit within a 6-week, 8-week treatment plan. Sometimes it takes a little bit longer to process complex grief or trauma, more than 8 weeks. And so what does that look like when your treatment plan, you're trying to formulate these things and you're trying to fit someone's experience into a model that was not meant to reflect them? Next slide. So so for me, at least, where I start, because it can feel very hopeless, where I always start is by acknowledging what's in the room, right? So when I see when a client comes to me, I'm acknowledging that they're there, as well as their childhood, any past traumas that they have gone to, their own values, all of that comes into the room. But what are some of the other things that could inadvertently slip in on a systems level? So let's go back to Bronfenbrenner and his different levels. When we're talking about the macro system, right? When we're talking about culture and laws and religion and dominant values, the dominant values are often not set by the client, but are set by the practitioner and the institutions in which the care is happening. So a lot of times what a resolution means, what healed means, is not defined by the client, but it's defined by the insurance company, it's defined by the court systems, or folks who were referred by court, our labor and health system, especially with employee-based models. We're trying to get folks to a level of healing that they can get back into the workplace to resume productivity. A lot of times as a social worker, we are assessing folks' basic needs like groceries, and all of those systems and all of those macro influences are in the room with us. And so I'm not expecting anyone to necessarily say, like, listen, I will devolve myself, I will get rid of insurance, I will excuse those things out of the room, right? Because that is privilege. Privilege is the ability for people to take those things out of the room, to say, hey, I don't want to talk about my job right now. That's a huge privilege. You know what I mean? I don't want to go through insurance. I want to be a private pay client. That is a huge privilege. And so really the first step is just acknowledging that these factors are in the room, because your client feels them. The client senses their presence. They have been navigating through these things in order to get to you. So we're not gatekeeping, or we're not to create the illusion that those things aren't there, can be very gaslighting. And I think the clearest thing to do is just to name them. When I was working with families and with parents who were court mandated to me, in my intake, I said, listen, there is a report that goes to a judge. The end result is determined by a family court officer. Now, in this, what are your personal goals, and how can we get your goals and successfully navigate this system to define your family or your outcomes the way that you would like? It's not by saying, let's forget about the judge. We're not going to forget about the judge. The judge is very present in the room. So next slide, please. All right. So again, to harken back to the KK's lovely slides. Once we move past the assessment stage and we're getting into building a relationship, And honestly, this is the core. This is the meat. I think that, I mean, if this was you, no shade, power to you, but I don't think anyone goes and tries to become a helping professional or a caregiver to be like, yes, I would love to write treatment plans. I would love to do the paperwork. It's actually the opposite. People want to build these relationships. People want to assist. They want to help. They want to better folks' lives. They want to alleviate suffering. And the relationship is where we build those things, right? So when we're talking about the different levels of oppression, a lot of times when people come to you, their their identified issue can be encapsulated at whatever level um their personal issue that they're bringing to you is often connected to a macro issue that can be defined at one of the levels of oppression, whether they're struggling with internalized oppression, interpersonal oppression, institutional oppression, or ideological oppression. And so to me, the overall arching goal, and which is why I got into social work, is because I believe that we can save the world if we're focusing on eradicating oppression. What would our sessions look like if we eradicated the oppressions that affect their lives so profoundly? What would my therapy session look like if I didn't have to talk about the ways in which I'm tired of navigating different systems as a queer Black woman? What would I even talk about? And I want to get to that place. So next slide. So in terms of micro practice, when we're talking we're working directly with a client. I want to give some tips on how to deal with the different isms that are in the room. So when we're talking about, so I actually want to start in the middle. So interpersonal, because a lot of times that is the oppression that we see the most. And so the example that I'll give, which is also applicable to me as a person of size or a person who is dealing with fat phobia in my life. So in interpersonal, I've had the rude subway comments of folks shouting slurs at me just every day in my life. And in a therapeutic relationship, what I would need help with in terms of that is someone to validate my experience and to help me help find ways to cope and deal with those and build up the resiliency that that my internal worth is not connected to my body size. In terms of institutional, when we talk about fat phobia, right? It's an institution. There are chairs that are designed for certain types of people. There are scales that are designed for certain type of people. When we talk about accessibility, a lot of times people lean just towards wheelchair dependent folks in terms of accessibility. But similarly, walking up as a caseworker, walking up to a 6th floor walk up is not accessible for someone who is in my body. And so to understand, so helping clients or someone helping me to navigate those systems, to understand my rights, to understand the supports that are available to help me within healthcare or within whatever system, that's the type of support I need for battling institutional oppression. Then we talk about ideological. And ideological is so much more pervasive, but we see that they're connected by that little squiggle. So institutional and ideological are very much protected because institutions are built off of those dominant narratives that persist in our society, right? And so for ideological, just fat phobia, what a normal body is supposed to look like, diet culture, it is everywhere. It is like the water that you breathe. Anyone who has ever struggled with disordered eating, eating is something that we can't not do in our lives. And so for a person who is struggling with disordered eating, that's often one of the hardest things to overcome because that is a factor we have to consume. We have to eat in order to sustain life. And so for that, it is finding a way to resist. that it's acknowledging that those pressures are there over and over and over again, and finding a way to maintain that self-love, that self-worth, despite those images telling you that water is wet and gravity brings things down. It almost becomes like a capital T truth. And so it's having a partner in fighting those ideological ideas that are so pervasive in our society that we forget that they're harmful and we forget that they're wrong. And so it's about protecting that person's peace. And then that brings us up to the top in terms of internalized, because again, those those pervasive messages, especially throughout my life, that I've received about diet culture and eating and body shape, especially as a child, it was really, really hard to not internalize those. And often the people who are the most oppressed can be gatekeepers for that oppression, right? When we and having a Black mother and having Black parenting, we talk about how Black parents are often teach their child resiliency through rejection, because they're trying to prepare them for a world in which they are going to be rejected. And so that's in ways that we've internalized those messages in order to protect ourselves or protect our children or the people we care about. But at the end of the day, they're harmful. So please let me know if there's any questions on this and we can go deeper into this, but next slide. All right, so then we go to termination. And it was really interesting because in reviewing for this, we even discussed like termination as a word. And it's like, oh, that seems so harsh. That seems so like, termination. But even the word termination, it's within our lexicon as providers. We terminate, right? And that's the way our healthcare system is set up, that we have our 8 sessions or our 10 sessions, or insurance doesn't renew. So we're saying, hey, go back to your primary, get another referral, and then I'll see you then, right? And so we have to deal with, how do we close out, right? So for me, I have that picture of the GPS, and it might be silly, but the analogy that I use is almost like a GPS. When you're assisting someone with navigating, did you help them understand the landscape and understand the journey that they're trying to go? Do they understand independently what are some of the next steps in their life journey? Or were you that GPS that now you're on 1% battery and then you die and you just leave, the phone dies and you're leaving someone stranded in the middle of nowhere, not knowing where the heck they are or what to do, right? And it can often become, we're building this dependent relationship where people are dependent on us as providers, not because they want to, but because a lot of times systems are built in, have dependency built in, so that they're getting their resources for survival through us. And the biggest thing is, how can I facilitate and nurture the development of those skills and strategies within yourself? Because you existed and survived and persevered before me, and I want you to exist and survive and persevere after our work is done. So always thinking just before the not just in termination, but throughout the therapeutic relationship, we want to think about, hey, am I building their skill? Or am I developing a relationship in which someone is dependent? And then once this relationship, or once this is no longer available, that I'm leaving them more stranded than maybe they came in. And so overall, I'm just very excited about this because I'm a student of NYU. I came through their micro macro program, and I'm very passionate that the work of practitioners are to help people, help that individual, that person in the middle, navigate those larger macro systems and chrono systems? And are we helping them, or are we creating dependence? All right, and then that is my last slide. So we're here. We just so happen to be queer as well. So we're here, we're queer, and we're interested in answering some questions. Hey, Karen.
Thank you all. Thank you all. That was amazing. KK and Laura, how lucky are we to have you today? We're going to move into our facilitated discussion now, so that we can, I'm going to be asking questions to KK and Laura, but we also want this to be a conversation with you all as our audience. So please chime in. I'll be reading the chat as we continue with our questions. Our first question is, if you move to the next slide, where do we start? So some of you may be listening to this presentation and thinking, yes, this is so important. I make so much sense, but where do I start? Where do I start when I have to write my treatment plan in 30 days and get all my notes in? Where do I start when I realize that I've been using the ACEs and maybe, relying on that in a way that I didn't think about who was missing from it, right? Where do we start? KK, Laura?
So I've been sitting with this question for a while because, I didn't know where to start. Also, every school I've ever gone to has told me to separate myself to be able to give care and to build really strong boundaries to the point where they become like solid walls and I can't like connect. I mean, as someone who's worked with children, what damage am I doing if I'm in the grocery and I see a kid who was in my office and they're like want to say hi or should introduce me to their parent because they're a kid? I'm rejecting them if I pretend I don't know them or I act awkwardly or different than how I see them in the office, where I gave them toys to play with. I asked them how their day was. I gave them a snack. And then they see me in the grocery, happenstance, and I pretend I don't know them or I'm rigid. Like, we start with ourselves. It's like I need to know or be aware of who I'm presenting to this person, because trust is being consistent. And if you're inconsistent, saying like, hey, I am sorry, I was terrified when I saw you out in public and I was nervous and I messed up. Like, being able to have those conversations is still maintaining a professional boundary, but you're also saying, I'm not infallible. And it builds trust so that you can mess up. And intersectionality is about, first, from my perspective, is knowing my intersecting identities and sort of healing from those as well within the systems of oppression. And that's sort of where I start. Laura?
So yeah, honestly, it's really starting with self. And when I talked about like that case conceptualization before the client is even a twinkle, I work with little kids, so before they're even a twinkle in their parent's eye, I'm thinking about myself and what I bring into the space and really understanding my identity. I think in a way, self-care is not selfish. But taking that lens and applying it to yourself, seeing what privileges you hold, what areas, what topics you're uncomfortable with. As a consultant and in my job, I do a lot of training for on working with LGBTQ folk. And I often make it a safe space to be like, there are a lot of macro reasons and there are a lot of things in our culture and society that would make you have homophobic beliefs. And if certain things make you feel uncomfortable, right? Instead of running away from them or denying them and saying, nope, I'm neutral. Nope, that doesn't belong here. naming them and acknowledging them for yourself, and really having that cultural humility, but that cultural humility in terms of your own insight and learning and growing in terms of your own reactions and your experiences and your lens and what you're bringing into the room. Because I think every interaction is a relationship. And in order to get mastery of that relationship, 50% or more of that relationship is you. So understanding you will help you be able to navigate how to connect to others.
So Kara,
Mhm.
just one thing. So for some people, it might be the first time they're coming to this conversation, and we've been trained again to keep ourselves separate. So it might even be like a bit of a feat right now to bring yourself fully into the space, because you were probably told to be here to get some credit, or for like CEUs or something, to do with your workday. And a place that I found myself first starting was when I worked with kids. I did that Cornell Institute's therapeutic crisis intervention. And it has been a tool that I now use every single time I have to navigate interpersonal um, activities or scenarios. And it's a tool that most of us know. It's sort of like the 4 questions, the inventory, where it's like, um, what am I feeling in the moment? Sort of, am I the best person to respond to this? And then the inventory, the first half of it is just a check-in with yourself. And then the other half is like, what does this young person or the person in front of you need in this moment? And then there's also a check-in, like, am I going to make this worse, or am I the right person to handle it? And so in all crisis scenarios, we are taught to sort of like scan the environment, scan ourselves. When we talk about difficult conversations with people, a lot of like, our supervisors or mentors will be like, take a deep breath. That in itself is, where do you start? Take a deep breath, go for a walk, drink some water. We have these pat answers and responses to things, but that's what intersectionality is. That is what it means navigating these systems. Is like quick reflection, build a muscle to check in with yourself, because it begins with you.
Thank you, KK. Thank you. Please share who you are if you would like to. And I think you're right. We are taught to separate ourselves from our work in a way that um, ends up doing more harm, and maybe just to us, if nothing else. I'm a queer identifying, I call myself an Italian hillbilly. I grew up in West Virginia, a single mom. And so it took me a long time to realize, I'm queer. I, yeah, let me own this. Let me own who I am, and how my privilege, right, as a white woman impacts my relationships, and how my understanding of socioeconomic status impacts my relationships and healing relationships. And how do I heal myself, those parts of myself, right? So starting with yourself, share who you are. So we have, thank you so much to Cynthia. Cynthia chatted in, said, I'm a Black Caribbean American therapist, trained professional counselor. What are the cultural challenges that impede helping Caucasian therapists to navigate when working with clients? Taking one class on multicultural issues doesn't do it. And let me say, as a 67-year-old Black woman, I have seen gradual changes in training since grad school in the 1980s. I was fortunate to have been in very good programs. Thank you, Cynthia, for being here. And yes, I agree. I think that's one of the reasons we're here and having these conversations. And these are conversations we have a lot in CTAC, in terms of how can we really support culturally, how can we do culturally responsive care? How can we do that better in all of our work, and share it with providers? Leo, white disabled woman, mother, therapist. Thank you. Laura, I'm a certified peer support specialist. I work in outreach to the homelessness population. I'm fighting stigma and prejudices that they are homeless due to stereotypes. This is not true. I am learning how to overcome this. Thank you, Laura. They're lucky to have you. Thank you. Anybody else share in the chat, and we're going to keep talking and would love to hear from you at any time. How do we build relationships?
So as we're thinking about it, like I'm from the Caribbean. So whoever texted and said they're from the Caribbean, yes, we're fantastic people. But what are relationships? So we don't define what it means to be in a relationship with someone. And we also are taught that relationships are highly transactional. Especially when we're dealing with care, it also becomes transactional. And we're from a culture, like we exist in a culture, we may not be from it, where we're taught to be individuals. And so we take on a lot of these punishing thoughts, corrections to ourselves as if they're on us. And so when you talk about people being unhoused and being responsible in these stereotypes, we also cherry pick and reward the people who made it. And I've navigated so many conversations with people who are doing better, and they can't find the empathy and the compassion for people who are experiencing things they did in the past. They're like, well, I got myself out of it. I pulled myself up by my bootstraps. And one, it is physically impossible to pull yourself up by your own bootstraps. And that's where the expression comes from, to talk about how impossible it is. And healing and care work is communal by nature. We do it all the time in mutual aid, in the ways we have support groups, the way AA works to talk about substance abuse prevention and working with addicts and supporting each other. Like the healing modalities that we use are communal in nature. But when it comes to talking about it, we pretend that we're separate beings. And so first we need to know that relationships are super important. I have had past clients come up to me and say nothing about what we did in therapy, but they'll be like, you had this poster on your wall, and I always wanted to go to that place, and so I did. We see and interact with people on so many different levels, and like I think integrity and honesty is how we build relationships, and like admitting we mess up. Laura.
Definitely. I was going to say, really, I want to shout out my cousin, Brene Brown. You know, we're really like sisters, Brene and I, Laura Brown, Brene Brown. But yes, to have the culture of the courage, and the vulnerability to be wrong. And not just wrong, like wrong as hell, like really wrong. And that, especially in, I will speak for myself. I felt in my process of building my praxis, when I went to school, there was a lot of pressure to be the expert, to know everything, to come and help those people who didn't have a master's degree, who didn't have access to them. And I was in my head building myself up to be some messiah to the masses. And really, for me, it took the unlearning of that, the continual unlearning. And the bad thing, or like the hard thing about unlearning that, is because the system around me still still pushes that narrative that I should be the expert. I should know the things, and people are coming to me to learn. And there are situations in which that dynamic is praised. And so really, for me, it's the privilege of saying, to recognize that dynamic as unbalanced and unhealthy, and to step away from it, even though I'm benefiting from it. So as a therapist, like really analyzing that and dethroning myself, which can be a very painful process. And it's painful not because your own, or I'll speak for myself, not because of my own delusions, but because there's so much societal pressure. to be there. So it's really about unmasking myself, unlearning that dynamic, and opening up myself up to be wrong. And I think that therapy is a vulnerable space. And we don't talk enough about when vulnerability meets vulnerability. That can be healing, and demonstrating my own vulnerability and not making it my own therapy session, but talking about my struggles as a human and invalidating those struggles in other people. That's where someone doesn't have to walk in my shoes, but if I'm open about my experience, I think that's where that trust comes from. People aren't going to trust based off your words. They're going to trust based off of your actions. And it takes, a lot of times it takes acts of not just empathy or sympathy, but it takes acts of your own vulnerability to build that trust.
Thank you, Laura. Thank you, KK. I completely agree. I don't have anything more to add to what you all have said. You've said it all. But Laura did chat in. I feel like it's by listening more than talking with others. Yes.
Absolutely.
Mm.
Go ahead. Sorry.
Oh, no, you go ahead.
And I was going to say, and I think for Laura, like I said in the chat, big ups to all my peers. But I think, you know, why the certification of peers is becoming such a movement is because they're like, oh, people don't want to talk to a perfect person who has it all figured out. They want to talk to someone who has been through that struggle or is currently struggling. They want somebody to join them in that struggle and not just observe from the sidelines and be a cheerleader. Who would have thought, you know? And so for me, I have part of my intersectionality practice is by unlearning some of that, some of the traditional tropes and boundaries of traditional psychotherapy and leaning into that peer model. You know, with my teens all the time, you know, my teen was like, I'm struggling with ADHD. And I'm like, yeah, it's neurospicy over here too. Because people don't want to hear from an expert. They want to hear from someone who can share in their experience and sit with them.
Yes. I think you're making me think about this idea of disclosure, right? That we're taught that we don't disclose. We are, and I think that's where kind of the separation of ourselves comes from, right? And so, but there are ways to disclose that's so healing and helpful, right? And we always ask our questions: are we disclosing for ourselves or for the person that's in front of us, right? Or that's across from us or wherever. And just remember that. And I think listening and letting people share their stories. Thank you for that link, KK. It's incredibly helpful. Should we go to the next question?
Yeah, well, I shared in the link. I love Mia Mingus. And, you know, for someone, they write so beautifully about we have stories to tell. And the stories we tell just enrich communities more. Like even just, you know, the blurb they have at the top of their blog, it's like leaving bodies of evidence so that people know that we existed. And we live in a culture where we are shamed for needing help. And I think that keeps many of us from building those relationships. And so when I talk about using intersectional frameworks, I'm talking about bringing my whole self to an interaction. And there's a difference between saying, I've had family members who struggle with addiction and telling stories of the most terrible things in a therapy session. And many people don't understand that there are ways we can talk to folks to build relation through connected experiences without compromising your vulnerability. And we need that because many of us resent needing help because we've been told that you should do this. You should be able to do this. Look at so and so. And, you know, it's going to stick with me forever, Laura's expression of resilience through rejection. When I think of, like, you know, coming home with 98% and being asked where the other 2% went, or being told that, you know, 5% of your grade was just getting your name right. It's just, you know, that is rejection. And like, if we don't talk to each other, we don't workshop how to build relationships. And even our colleagues silo themselves because we're taught to compete with each other. And people have caseloads and we're piling more on them. And we judge other people by their caseload. We judge people when they go on vacation. We judge people for taking mental health days. And so the impact of intersectionality is more so about, like, how much of myself do I have to leave behind? How much of my humanity I separate to now connect with another human. And it's a painful process that exploits us. And that's capitalism. How much of my humanity I have to leave behind so I can exploit another human for productivity. And we're seeing it in our caregiving, right? Like our intake forms. Like, if you can't fit into my box, I can't treat you. And that's not why we became caregivers, right? And so the impact is the person and that relationship, but we need to talk about, like, what would it mean for me to show up in a space and say, you know, I do DV work because I've watched survivors, I've lived with survivors, I've loved survivors, or I'm a survivor myself. Like, you know, we should be able to say that, because people shouldn't deny themselves help because they don't want to see like they're in need.
Yes. Yes. Laura says, yes, Cynthia says, yes, yes, yes. And Laura says, very true. Nicole Ramos said, had an answer to question 2 that I missed. I'm sorry, Nicole, that you were saying being relatable and consistent is important, an important way of building relationships. Thank you. And then we had a comment: as someone who works in an institution that is bathed in implicit and explicit biases, I find myself constantly having to tell patients and employees that it is not their responsibility to educate others by re-traumatizing themselves. Individual accountability is doing the work, is a standard that we need to hold ourselves and other people to. Thank you. Yeah.
Absolutely.
Yes.
Read a book is always a really great response. And I think it's also hard because in that, like, we navigate, or at least I navigate those spaces, because even in this space right now, is as an educator, you know, I'm here to respond to those questions and to help people on their learning journey. But what some folks don't understand is that that's not consistent, like, through my life. You know what I mean? There are just some days or some situations in which I want to be the person who's held in the space and not the person who's holding the space. And I think what that also brings in is, like, what happens when you are supporting a community that you're a part of, when you're part of the us and the them. Like, you know, you're the provider, but then you're also saying, like, hey, I'm writing this, like, for like, I'm doing this for myself. And what does that look like as well? So I really, really appreciate that comment. It's something that I think about in my praxis a lot.
I'm so sorry. I don't want to Suyi. Oh, hey, Suyi. Thanks, Suyi. I'm so sorry. I'm mispronouncing your name. I don't know if anyone could go. Can they go off of chat and speak? Leslie? be
If
great.
you raise your hand, I can unmute
You
myself.
raise your hand. It'd be great to have other voices. Does anybody want to raise their hand? Laura's saying she has other peers to go to in supervision. Sue Yeast had a question. Where do
I
we
see it. Yeah. Where do we draw the line between advocating and educating? I mean, that's personal. We all have different thresholds. And as a person of color and an immigrant, there are some days I cannot carry the burden because, as Laura said, I'm an us and a them, right? And so that's where allies and accomplices come in. And that's where creating a culture for these conversations come in. We work at institutions that are toxic because our livelihood depends on not the quality of care, but the quantity of care. That's how we get grants. We need to fill the beds. We need to report the beds and the time in beds and how many, meals we gave out, how many seats were taken. And, you know, it's so tedious that the quality suffers to meet those quantity thresholds. And so if you're a member of that community, advocating and educating is something that's not your sole responsibility. And if it feels like the sole responsibility, then that's a big red flag about where you're working, because that's burnout heading your way. I've worked at many organizations that were toxic, but they were trying. And I've stayed the longest at those that were trying. And we need allies and accomplices. We need the managers, the supervisors, the executive directors to admit that they can be wrong and not punish people for being the loudest voices when things go wrong. And we need to be able to identify it. And, we need to talk about HR. Human resources is not about human relationships. Human resources is about not getting sued or, being penalized for harassment at work. And so when we talk about advocating versus educating, like, when you advocate, it should be enough for HR to see a gap in knowledge and add a training. But we don't have those organizational cultural conversations. We don't recognize that culturally the behavior happening in this community is different from what was happening in this community. And, it could be translating the information. It could be understanding culturally that we don't talk about sex. And so giving out condoms without context means that nobody's going to use it in one community. But what if we have a campaign that says, this is how you protect yourself because we're seeing this happening? Like, advocating and educating go hand in hand. And I'm sorry that you have to get to a point where you need to figure out where you draw the line. And I'm just saying, I have no answer other than that's wrong and it shouldn't be happening and it's a red flag.
Thank you.
Yeah, and I definitely to think about the culture and environment, because I agree with KK. I haven't found the perfect institution yet. I have found a lot that are trying, but what I will say is there needs to be trying from the top. It needs to be an environment, because environments that are kind of doing grassroots campaign within a nonprofit or within an organization is really, really tough. It really needs to be commitments to this change, or at least signs of commitment to from the change from the top down. And I think that's a big thing between advocating and educating. And even coming in here, coming into this room, in this space, the first thing I said was I was very nervous. I'm still a little nervous because this is personal for me. This is, there's a level of vulnerability because I'm talking about my identities and my body size and my experience. But the other thing is, how much do we owe vulnerability if the other people within the organization aren't willing to reciprocate that, because then it becomes kind of like trauma porn where you're detailing all of these areas in which you are sensitive and you are being vulnerable, but that vulnerability isn't being reciprocated. And and in many toxic environments, those vulnerabilities are then used as weapons against you. So I really do think it really depends on the culture, like of the culture of the agency, of the culture the environment that you're doing that practice in. There's different levels. And for myself, kind of like that kaleidoscope shifting in different environments, I appear in different ways. And for myself, it's about finding the balance where it's, can I show up as my authentic self, where I feel like I'm able to talk about the things that mean the most to me without that fear of retribution. And when I do speak about my experience, or I'm educating or I'm advocating, is that being heard? And depending on whether that answer is yes or no, kind of depends on your level of obligation or your effectiveness in educating. Because at the end of the day, we can't educate, or we can't force progress on a person or an organization that does not want to.
Thank you. Suyi, did you want to unmute?
Thank you. Thank you both for your presentation and for being willing to share. And I think that where I was coming from, that I think there's particular industries, you see it a lot, and it's hard to kind of compartmentalize a lot of experiences, because especially within like healthcare, you have, you can witness bias and all of these isms. You can experience it from your work environment, you can experience it from the people you're trying to help. And it's just hard to kind of filter all of it out. And it does become exhausting when you have to, are you educating the place where you work at, the people that you're trying to help, and it's just a lot. So that's, I think, where I was coming from. But I think you're 100% right. You do, when you start to advocate, you do have to be in a place of vulnerability, because you are kind of opening yourself up. And I think it unfortunately deters people from doing that for fear of retribution. Because what are you saying? Are you saying that the organization isn't doing their part? Are you, if you're not promoting, are you tearing down? Some people feel that kind of notion. So, but yeah, that's kind of where my insight was coming from. And thank you again both for sharing your experiences. I appreciate it.
Thank you so much. Laura, Leo chimed in, transparency is so helpful to understand the limitations of supervisors, managers, and allows for buy-in for staff. Transparency, I think, is incredibly important. And Laura said, it's a fine line. I've created boundaries. I speak about my experiences that will help someone else. So thinking of that as advocacy, it sounds like that's what you're saying. Thank you for chatting in. Let's move on to question 3. There are some takeaways that we want to, that KK and Laura also have. But question 3 is, what is the impact of intersectionality?
Honestly, like, this has been such a great conversation that this has really been covered in a lot of other questions, but really the impact of the intersectionality is, at least for me, is that continuous process of questioning everything, relearning everything, and then and just really, the more you know, the more you learn, the more you realize how much, the immensity of what you don't know and what you'll never be able to know. And I think that is coming into that realization, like, the more you learn and kind of becoming that mastery. And it's like, yes, I have a master's degree, but in terms of that mastery, it's realizing, like, oh, I'm never going to get there. There's always going to be more things that I don't know than what I do know. And building comfort in that flow.
Yes, love that. Thank you.
Um, it builds resilience
Mm.
because you're connecting with people, you're building a team, you're building trust. And you know, I will say my privilege that I've created for myself is that I work for myself now. I have my own consulting practice after years and years of trying to fit myself into toxic environments. And I've been fortunate and privileged enough to have a solid mind for business. You know, we didn't talk, you know, our bios don't capture all of us, but I started my life as an auditor. I worked at Ernst & Young. I have an accounting degree. I felt fancy and made a lot of money, and it didn't fit me because I thought at the time growing up that that's what I needed for things to be okay. And the impact of applying an intersectional lens to my work means that I don't leave any of myself behind. And it's still not perfect because I find myself leaning into forgetting pieces of me behind so I could do something. And now when I work with my clients, I talk to them about, you know, if it feels uncomfortable to do something, like, is it discomfort because you're growing, or is it discomfort because you're actually harming yourself? And we need to talk about those in spaces because, you know, I'm watching Daniel's statement and question. It's sort of like we have to open the curtains and show the little magic that's happening behind, because none of us come to caregiving because we all had great lives and everybody we knew had great lives. We come because we get a message that something was wrong. And we can't fix it until we name it. And we have to be vulnerable to say that sometimes harm reduction is enough. Because dismantling systems and systemic reform is not an individual task. It's not an individual process. It's not the hero that every movie has been made out of. You know, it's just, Gandhi didn't just, like, go free India, you know, this toxic, sexist, misogynistic man, because history writes the narrative of this perfect, humble person, did this with hundreds of women behind him. And we need to burst this open and talk about the reality, because intersectionality means that there are other people in this story, people who might share identities with me. You know, but the joke my wife and I share quite often is that, Adam Smith went back home to live with his mom to write The Wealth of Nations. The father of economics wrote his greatest piece of research while living at home, which is why women's labor is invisible, because his mother's work was invisible. She upheld him during that whole time. Thoreau wrote about living in the wilderness and romanticized living off the land, but he was living on his friend's estate, and they visit him once a week to share drinks and celebrate. History doesn't tell us that. And intersectionality, the impact is that we can see the false history we've been had, the narratives of the individual, and that those are all lies. And doing our own work is self-care. I feel so good knowing that these brilliant geniuses were actually living at home or struggling like the rest of us and couldn't do it without the help. But the narratives punishes those of us who buy into it, thinking of it as fact and truth, and it's not. And acknowledging people's histories, the complexity of humanity, and that putting people on a pedestal will always fail us, because no one is perfect. And those are the things that, Dr. Akun names in their characteristics of white supremacy, that we've been forced to learn. And we've been forced to learn because systemically, many of us are not cis, white, heterosexual, Anglo-Saxon Christian men. Many of us are people whose families have struggled, who've seen struggle, and then moved on to caregiving. And to me, that's been the greatest impact in my life of adding an intersectional lens, is just like realizing, oh, this is not on me. I have to start somewhere. Harm reduction is just as important. Like, I can fight world hunger, but I can also give someone a sandwich right now. And it's as impactful as dismantling a system that denies people access to healthy food.
And I want to uplift in the comment, because Daniel's bringing all the tea, but just said, people in our field tend to believe that they are doing their best to advance justice-oriented endeavors, but this sometimes makes it hard for leaders to practice humility and grow when we are all gatekeepers in every system of oppression. Daniel, no one can, telling the truth, you had to put a trigger warning on that one, like, because, ooh, you are speaking some testimony. So I wanted to go to your question, which is, how do we support one another in our growth, and what does it take for people above us in institutions to self-reflect when it doesn't seem like they always understand their role in perpetuating harm? The big thing that I want to bring in, I think this is a great time to bring in critical race theory. And it is often hard because when people are like, no one, and I truly do believe this, no one gets into the work of caretaking, I truly believe, in order to perpetuate harm. Honestly, because there are much faster, more efficient, and better paid ways to do that. I don't think anyone becomes a social worker to perpetuate harm. But at the same time, especially the higher you get into an organization, that vulnerability starts to disappear. And I think that ties into like privilege and power, right? Because when you take off that crown, when you dethrone yourself as the expert, what does that mean when you're also a leader? Because our leaders aren't supposed to ask for help. Our leaders are supposed to know how to do everything perfectly. And I think that's a bigger systemic thing, because it's like, I would say the first thing is to make sure that those relationships, the supervision relationships are reciprocal. Like, I have times with my supervisor where we talk about my things, but sometimes we talk about their things too, because they're a human doing this work in the same place that I'm doing this work. And it's actually really affirming for me to see that they're struggling with some of the same questions that I'm struggling with. And it makes me feel like not gaslit, you know what I mean, that they have everything perfect and I'm struggling. I think in that way, I think it's creating those systems like emergent strategies, or dismantling those ideological theories that we have to be perfect, because perfectionism and individualism are capitalistic, and our nonprofit systems feed those qualities, those capitalist qualities. So I think it's about, number one, naming it, creating, like, supervisors need safe spaces too, creating safe spaces for supervisors and folks in power, or folks that are in leadership, to express concerns or areas of growth without being dispensed or removed from their position of power because they're admitting areas of growth. But then I think, so I think in that it's wider, because as a person who still functions within nonprofit systems. I am a therapist. I do bill insurance. I do create treatment plans. So, you know what I mean? As much as I would love to blow up systems, I have to work within systems. And the ways that I have protected myself with working in systems are having people, accountability partners like KK, who that I can go to outside of my work to also support my personal growth. And it's realizing that as even though the good intention might be there, like KK said, HR isn't necessarily for your human resources or your personal development, but still emphasizing your personal development by having people outside. And so I think a good leader has stakeholders both within and outside their organization who can really say to them, listen, I want to have a space of accountability because I see that you're drifting away from your values or your intention.
Thank you, Laura. Thank you so much. Such a profound answer. And you touched on so many pieces. Thank you so much. We're going to do questions 4 and 5 together so we can get through a few takeaways, and then we think we may have time for some questions, but I'm not sure. So chat them in if you have any, and we'll talk about those at the end. So question 4 is how to respond to conflict.
And could we get a question 5 as well? And
Yep.
this way,
is
yeah.
how to hold each other accountable.
So we've brought this up multiple times, and Laura, if you're burning to say something, just give me a signal. Otherwise, I'm going to try to race through and get through the takeaways so people can do some additional questions at the end. But honestly, all we've been talking about is conflict within ourselves and how we do this work and how do we do it when it's not received in a way that's affirming. And then how do we hold each other accountable? I just want you to know that it's not on you, and we have the tools. Like, we do this on a daily basis. We navigate difficult relationships with family members, with our parents, grandparents, aunts, uncles, that sibling you don't talk to. And when I say this, I'm actively thinking of one of my siblings that I don't talk to because of how hard it is, because conflict is inevitable. When you're dealing with people and asking them to bring their whole selves and you don't do it, you don't have the trust, and conflict's going to happen much faster. But conflict is powerful. Conflict is that impetus for change and doing something differently. And that in itself is accountability. And so, Kara, if we could move to the tools, I can sort of like just say in response to these questions, like, we have the tools, like we've mentioned them. Laura and I have sort of bared ourselves to you all, showing how we apply it. Like, you already have tools in your toolbox to use an intersectional lens. You know, if you're a social worker, the NASW has guidelines. If you're a psychologist, a psychotherapist, a psychiatrist, the APA has guidelines on how to talk to different communities. They also list health disparities and tell you why certain people will show up for care because of these experiences. I use a therapeutic crisis intervention as someone who's had to work in foster care directly with children who've experienced trauma. It was a way to address conflict in a way, hopefully, did not harm either of us involved. And you are already an expert of all of your identities because they're yours. No one can tell you who you are, how you feel. You know this, and you can find those points of relatability with the person in front of you. We all know what it is to feel hungry. We may not all know how to be, that we're starving, but we know what it means to skip a meal and how we can't think about anything else until we get that meal. And so maybe providing food at a group where you're talking to unhoused people might alleviate stress. Like, you have a toolkit that applies intersectional lenses to the work you already do. Next slide. So we're not asking you to reinvent the wheel. You also have theoretical frameworks that help you understand your toolkit much better. And we've added some of ours, but I love Bronfenbrenner's ecological systems theory. Basically, we know that people are people, the communities we live in shape us, And then if you are a person of marginalized identities, society's responses to you will also shape you. We know this. You have tools. We're just going to name them so that you can think of them as tools and connect them. Because in praxis, we need to think and connect them. Next slide. And you have tools that you've created for yourself. Why you do this work, how you show up, what you wear, who your friends are, who you don't talk to, the places you go, what you eat. These are our values. It's the ways we have built toolkits for our identities. And so we're not just saying be intersectional and go out there and save the world. It's sort of like, these are the tools you have at your fingertips. You have them every day. Let's apply them. Next slide. Use them. Just use them. If you're religious, I am pretty sure you have frameworks and tools that should help you express empathy to others. Just not let that be the only tool. Let's try to, figure out ways that we can bring our whole space, our whole selves to navigate these spaces. Who are you in this moment? Identity salience goes hand in hand with intersectionality, because the identities that are at the forefront of my present being changes from time to time. In the winter, I wake up and I have the identity that I used to be an athlete and now I have arthritis. This is terrifying. And that is a salient identity for me. One who needs accessibility to be able to walk in and out of the house. Do I have to climb 6 flights of stairs in the winter? Because I'm not going to do it because it's painful. Next slide. You're not in a vacuum. We have our peers. We have each other. And you don't have to invent the wheel yourself. There are opportunities like this. Read books, join a group. In my business, we have a Friday morning meeting that's only feelings. We're not allowed to bring up any work. And my white business partners, I remind them that white affinity groups need to happen, because too often I find ourselves perpetuating some of these systemic injustices. Like, I will worry all week about something happening next week, and they will only worry about it 2 to 3 days before, because they don't have my anxiety about failing. They have different anxieties, right? Keep learning, find and connect with folks, and then really put yourself in that space. Next slide. Practice, praxis. It'll take time. It's an iterative process, which means you have to keep doing it over and over and over again, and you're not going to get the same results. There's sometimes I will say things to one of my siblings and it's fine. I will say the same thing to the same sibling on a different day and it's not. It's iterative. We have to keep going. Next slide. And see the world. Laura, this is yours.
Yes.
Go.
So, really in the way that I've identified perspectives to take for the different levels of oppression in therapeutic spaces, macro practice, I think, is really important, just as a person of the world and trying to make those differences outside of yourself professionally. But in terms of addressing that internalized conflict, you want to do consciousness raising. Consciousness raising is not new. I want to reclaim the word woke, but it really came from being vigilant to open your eyes. And I think the radical right has really taken woke and distorted it into something completely not iterative. But I think it's really important to go past that shame and be like, hey, where are my areas of growth? Where am I uncomfortable? And why am I uncomfortable? In terms of interpersonal, if you see something, say something. We want to protect folks who are oppressed, and we want to interrupt interpersonal violence when we see it. in terms of institutional and ideological, we want to, from institutions, we want to divert as much as possible. If we see, I think that's why boycotting has, in terms of if we see a company that does not align with our values, I will say for me in Chick-fil-A, does delicious chicken sandwiches does not align with my values. So I have to unfortunately divert from my support of that institution as much as you can. And then in terms of ideological oppression, we want to divest, we want to separate ourselves from that overarching dialogue, but we also want to amplify voices that aren't usually heard.
And so I've said this before, and again, you're going to get all of the slides followed up by a comprehensive tool of resources that we've also named here. And so you're going to get these slides. Conflict is inevitable, and you have the tools to address it because you've been trained to deal with conflict on a daily basis. And understand who you are in the moment and what your own limitations are. You can't save everyone, and you shouldn't be the person to save everyone. Next slide. And so what we need to do is understand how to build relationships because it's not on us to fix everything. And so you're going to get these two slides. It's this one and the following one that basically just say, you don't have to be the spokesperson and the ally for every community and identity that exists there. Find out what those communities are doing to help themselves and amplify it. Because we live in a society that makes it difficult for us to connect. And you're going to fail. You're going to feel like you fail because we're not cookie cutter responses. We're not.
No one is perfect.
No one is perfect and no one knows everything. And we're dealing with a world that has hidden people's stories and histories, and you might be the first person to hear it in this context. And so honor those stories and ask people what it is they know that they need to be able to navigate this process with you. Next slide. And always be accountable. It's okay to make mistakes because we're not perfect. And you're accountable to the institutions that employ you because you will have to do your reports. You will have to do your treatment plans.
Mm-hmm.
And you can address the conflict you feel when maybe they leave people behind. You're accountable in these ways to the systems we exist in and to each other, and also to yourself and what makes you get up every day to navigate these spaces. So next slide. And so again, this amazing diagram from Kai Cheng Thom that helps me apply accountability and practice and praxis in my day-to-day. Like it's just saying you're sorry isn't going to cut it, because then that doesn't really rebuild and repair a relationship, because accountability is restorative justice. It's repairing relationships so that we can continue to work together. I know we're over time. You're going to get all of these, all of the resources. We've mentioned everything in our takeaways. Contact us. We are so easy to reach.
Yes, please take screenshots
Yes.
of our information, reach out to us, and we would love to hear from y'all.
And if NYU lets us sit for a few minutes, we can also respond to questions. But I also get it if they can't.
Thank you. Thank you, everyone. So appreciative of everything that's been discussed today. And this is our website. So you can go to our website and view past trainings. There's a feedback survey that pops up when you leave this, and I also put it in the chat. So if you can give us feedback from today, we'd really appreciate that. Contact us with any further questions or concerns, ctac.info@nyu.edu. I'm thinking that people are hopping off. If you want to email us questions you have about today, I can put something together, perhaps with you, KK and Laura, for some answers. You can also email me. I'll put my email here. You could email me personally with any questions you have so that we can respond to you, or even put a Q&A together. So it is 2:05. We're going to have to run. Thank you all so much for being here. Any last words? Any last thoughts? KK, Laura.
I just want to say thank you to all of you. I really appreciate all the questions and your energy, and just the fact that so many people showed up for this conversation is really restorative to me. And so my thing is, I'll see y'all out there. I'll see y'all on the battle lines, and I'm here for you, and I'm here to support you. And I'm glad that I have allies in y'all. And this is not goodbye, but it's a see you later.
Thank you.
Just thank you. And we fit like a years and years amount of knowledge and education in 2 hours. So feel free to be gentle with yourselves and peace through each one.
Happy summer, y'all.